Hi, welcome everyone, and we have Dr. Naveen Chinapati, who is going to present us on taking care of dental health during this COVID-19 and procedures to remediate any problems and the insurance costs. And Naveen is working as a state dental director and a senior associate at Spencer Dental. And he has graduated from Columbia University, New York, and and his basic dental was done in JSS College, Mysore. And he's going to take over from now. Naveen, I'm going to make you the host, sir.
Okay. Thank you, Ranki.
Sure, sir.
All right. Good afternoon, everyone. How everybody's doing with this COVID and like quarantine? I know it's like so at least some of the IT guys, you guys still are working, but I'm off from the work almost. It's my third week, and it's really boring. Nothing to do, just like all day, just look for some snacks in the boxes. So Ranki asked me like if I can do anything presentation over oral healthcare. I said let me get used for the society, at least like I can contribute something in this crisis. So today's topic, oral healthcare, and I know like some of you might know who is the highest risk for this coronavirus is dentist. If you see the stats, dentists are the number one. Dentist is the number one profession for the risk of coronavirus because we directly work inside their mouth. So we literally have to peep. So my office, like they asked me like if I can do some emergency patients. Yeah, of course, like they can't wait for until this quarantine is done for next 2 to 3 months. I know, like, can you imagine yourself being in so much tooth pain and wait for 2 to 3 months without anything? And if we deny that, then what is the next option? They have to go to ER. And if they go to ER and, like somehow they get contaminated with that virus and they come back and they spread it to the society. So we are doing our part by doing, like if not the directly involved with the corona patients, but at least we are trying to stop the spread indirectly. So what we do, like, since I said we are that highest risk, so we are thoroughly like examining, like a screening. We check their temperature, ask their history, then what we do, and we ask them to rinse with hydrogen peroxide their mouth for 40 to 60 seconds. And once they rinse, then we use this called rubber dam. Like basically, this rubber dam isolates the tooth from whole mouth, like so you don't see anything else except the tooth which you're working on. So that way, that prevents, like this is some of the precautions we are taking. And because like, and we use this high-speed handpiece, like a lot of aerosols, like I'm sure it's a lot of spray, and this virus can stay in that aerosol for almost like a 1 to 2 hours or like more than that, it can stay. So yeah, this is our, we are risky, and but still like, we have no options. We are doing like maybe our office is open like once or twice a week, just 8 to 12, like just 4 hours. We are taking only emergency patients, and this in case if any of you like really looking, only if you can't wait, I recommend you only if you can't wait, then only you see a dentist. Okay, so let's see, like, okay, so I'm sure how many of you like to visit dentists. I'm sure maybe less than under 5% you would love to see dentists because no one really loves dentists. Everybody's scared of them. But and also like you have this myth, dentist is very expensive. I'm gonna explain you right now, and then you're gonna come to conclusion. Dentist is not expensive. I'm gonna tell you what is expensive. Okay, let's go through this some of the slides. Okay, so you see this cavities here. This is the cavity when most of you ignore to go to dentist because it doesn't bother you. It's such a small black stuff, some like a dot. You won't even feel any sensitivity at this point, and there is no sensitivity, there is no pain or no discomfort. So why do you go to dentist? Because you feel you're good, and no, I never had a problem, so you don't go. Then
If you're sharing, Naveen, we can't see if you are thinking anything sharing.
you can't see this.
No.
Uh, but
No, I can see.
Naveen,
So you, you have to,
actually, you have to
if
just
you're using
click on that
your,
one. Yeah.
can you
Click
see?
on
Can
that.
you see this one?
so if you're using the phone, swipe on the video or the place where it sees you will see people. So the other one is the presentation.
Yep. We can see. Thank you.
You can see now.
Yep.
Can you
Thanks.
see this slide?
Yes, we can.
Okay, good.
Thank you.
Yeah, okay. Look at this cavity here right now. See that dark stuff? That is where that's called like a benign cavity. Like it's where the cavity when it starts, it's really small and it doesn't bother you. There is no sensitivity, no pain at this point. So 99.9% of the 99% people they ignore at this point. They don't go to dentist. It's not bothering me. Why should I go to dentist? Fine. So then they don't go. The next level, if you wait for 6 more months, the same cavity is going to turn into like this. It's going to get bigger. See all the, can you see the slide now, guys? Can you see the slides?
Yes.
Okay. So feel free to stop me at any point. If you don't see or if you don't understand anything, you can ask me any questions at any point. So the small cavity turned into big. It means the more bacteria, the bacteria multiplies. Like how the coronavirus multiplies, it's not going to stay. And you know what's its food? Any of you know, like what does the bacteria eat?
Whatever we eat.
Yeah. So mainly sugars.
Sugars. Okay.
So basically, it converts all the carbohydrates you eat into sugars, and that sugars is the food of the bacteria. When the bacteria eats the sugars, it releases acid. So only acid can eat the tooth. Imagine, because the enamel is the hardest substance in the body, not the bone. Imagine if this has to go like this, how much strong pH the acid has to be. So if you ignore in the first stage, then it becomes this. Okay. So at this point, you start seeing some kind of sensitivity, like when you drink something too hot, cold, or when you eat like a really ice cream, or you feel some kind of sensitivity. You still, like okay, it's not bothering me all day. It's just bothering me like very few times. So you still ignore. Then what's going to happen? The next stage is this. See this? This is completely like 3/4 of the tooth is gone. Whatever you eat, all the food is getting stuck there, and you take that toothpick and like keep plucking in the mouth. Okay, at this point you're gonna have some pain, and some people they wake up middle of the night and they can't go to bed. Okay, so and the next level is this. This is abscess. That is pus. Okay, this is abscess. You see in the X-ray radiograph. You see that the dark stuff. You see that is abscess. That is abscess. Like it's a abscess, nothing but pus. So this abscess drains. It doesn't have any room, so it drains out like that, and come out like this. So this is what. At this point, you have extreme pain. Like so much pain. And like only those who experience, they know how bad is the tooth pain. Some of my patients say my labor pain is better than this. The tooth pain is worse than labor pain. That's what they say. I never had such severe pain, but like I heard from a lot of people. So at this point, you have only two options, which is the number one is root canal. This is root canal. And then the next option, you can still save it, but it's very expensive. Your negligence became very expensive. Where it would have been prevented when it was a small black dot. You guys did not go to dentist, you ignored. Now the same dot became bigger and bigger and bigger and became like this. It turned into abscess. So when you have abscess, you need to take antibiotics, then you need to go to a dentist who can do root canals. So you see this point, these are white things. These are called GP points, gutta percha points. It means they substitute your nerve. You basically take out the nerve because the nerve is infected, it's dead. So there is no point. You don't want to keep any dead things in your body. You have to eliminate them. So basically, the dentist cleans all the nerve, and he gonna fill them with these white things called obturation or GP points. So here, the treatment is expensive. The root canal costs you at least $1,000, where you'd have prevent with $75 of filling. So which is expensive? The dentist or your negligence, right? Make sense?
Yeah. Naveen,
Yes.
quick question here. Like
Yeah.
during COVID-19, do you think like we should visit even for the small first
No.
sense, or do you how do you want to approach?
Don't go. Oh, like I said, only emergency. If you have so much pain, you can't wait for 1 or 2 months. Next 1 or 2 months, then only you go to dentist. Very emergency for the basic cleaning, simple fillings. It's okay. 2 months, it's not gonna make such big thing. It's gonna take at least 6 months. But in these 2 months, what you have to do to prevent? So cut down the feed. Whatever you're feeding the bacteria, cut down that. So clean it. Like don't let the food or get stuck in your teeth and like let it be there for more than 12 hours. So before the bacteria use that as acid, food and turn into acid. So finish up, clean your teeth, brush twice, and like cut down the sugars.
Okay.
If you can, take care, it won't spread faster. Like, if you don't do that, like it's gonna be like rapid fire, especially in kids. It is more faster in kids than adults because the enamel in the kids is not as strong as us.
Okay.
So it's easy for the bacteria to go faster. So this is the root canal. So at this point, like some of you can afford, and okay, it's not done. This is just $1,000 for the root canal, right? So after root canal, basically what happens, tooth is brittle. It's like it needs some support. It needs some support on the tooth. Here, see that the square I wrote. If you don't do that, the tooth is gonna break, crumble. Like when you try to chew something, it's gonna crumble. So you need some external support called crown. Okay. So where did I go? Okay. So these are you have option of variety of crowns. This is a solid zirconia crown, and you have a gold crown. Yeah, this is, by the way, it's not like India. It's a pure gold, like a 14-karat gold. I myself have given for so many patients these gold crowns, even including the front teeth. This is a PFM. It's called porcelain and metal, like a porcelain metal fused. And this is this is a zirconia crown. This is a gold crown, and this is a PFM crown. Got it? So this is another extra $700 to $800. So how much it cost you altogether? $1,700. Whereas you would have prevented with under $100, right? So it is not expensive. It's your negligence again. So we trying to tell them, but like most of them, they think this dentist is trying to make money. Like, I don't have any cavity. Like, I don't have any pain. Why are you saying I have cavities? So you don't have pain all the time when you have cavities. Only if you have a pain, it means you have only two options. One is a root canal. Then the next option is, see, if you wait more, like it's gonna turn into like this. You see all this?
Naveen, question for you here. Does all
tell your name and
this is Prasad, Naveen.
Oh, hi,
So Naveen, the question is, does no dental health plan covers these root canals?
No, they do cover. Thing is, the annual coverage for the dentistry since 1985 is $1,500. So your whole year plan covers one root canal, even little 200 shortage. So
okay.
Rest of the teeth and rest of the 31 teeth and rest of the year. So that's what I'm saying. Like,
okay,
so
okay.
By chance, if you got some other work, maybe like some other fillings or some deep cleaning, got it done like earlier year, your coverage is already almost half of done there.
Okay. So the amount. Okay.
Yeah. So it's not that it covers, but thing is like you have only $1,500 every year. That's very bad because I don't know. Maybe these are 1985 prices. They did not. None of the insurances increase that limit. It's still they go the same way.
Okay.
So if you still like those, some of them can afford, some of them can't afford. Once they can't afford, so it's gonna be like this. See that? Now at this point, I can't even do root canal, so we have to pull the teeth. So now look in the kids. Let me see what is this. How can I undo this? Okay. Can you see now these pictures clearly now? Kids' teeth. Okay. All right, look at this. This is called rampant caries in kids. Look at all this this kid's mouth, front teeth. Does any of you see if your kids has this kind of lesions? And they once if you ignore that, then gonna be like this, more darker. Remember, if you have kids under 5 or 6 years, it is very, very, very expensive because kids, this amount of this much of work you have to do. I mean, they're not grown-ups. They can't sit, like quiet, and they can't sit still. Like they'll be keep moving and crying and shouting, and it's not easy to work on kid stuff, like under 6 years. For especially 1 or 2 fillings easy, but this much work, what you have to do, you have to put them in sleep, like sedation, general anesthesia, or conscious sedation, or oral sedation. There are different options. So we'll talk about those options later. First, like, okay, what are the treatment? What you do, like, so why they get cavities like this? One thing is, like, obviously kids eat a lot of ice creams, candy, and sweets, sugars, and even you see cavities in kids of 1 year too. You might ask, like, they don't have teeth, like how come they have like this many cavities? So some of them have this habit, like when they're sleeping, they sleep with the milk bottle in the mouth. So what happens, like, that has a lot of sugar, that sugar is stucking, gets stuck to the teeth. And by the time they wake up next day morning, they have plenty of time, 12 hours almost, like more than 8 to 9 hours time, and like gone. The teeth are gone. So at this point, the fillings not gonna work. So some of you would have gone and the dentist would have said, like, they need crowns. So you might think, like, why they need crowns? Like, why we can do with the fillings? Yes, you can do with the fillings, but you have to remember one thing. These teeth, each teeth has a different age set. Like, let's say this front teeth, they're gonna fall around age of 7. Okay. You see this teeth here, the canine, around 10 or 11 years. Okay. So each tooth has a different age group. Like they're all are not gonna fall at the same time. So let's say in the back teeth, if they have a cavity and they say just a filling, but whatever the work you do, it has to stay for 6 to 7 years. These fillings, they're not meant for like such a longevity. So what they do, like, once for all, the permanent solution, they put caps like this. See this? This is the silver caps. I know in the front they look ugly here, but there is another option for like those who don't want these silver caps. There is a different option. These are white crowns. Yeah, they look good. These are white crowns. See that? All the white crowns. Yeah, these are called like a new smile crowns or strip crowns. Yeah, very expensive. Definitely very expensive. For kids is more expensive. Like whatever the 1,500 they provide, it's not enough. So the next option, yeah, like I was talking about the general anesthesia, right? So you can't like put them under. You cannot put them like in a regular nitrous oxide. What we do in the office, we have this thing called like nitrous oxide. This is also called laughing gas. Makes them relax. It makes them relax, and like some kids, like probably 50 to 60% of kids, they do good. But some kids, they're nervous and it's not gonna work. Then what we do, and some of the parents are apprehensive about putting their kids in sleep. The only option then we have is like wrap them around, like we tie them up in a kind of a blanket. That is basically to protect the kid, like not to traumatize him. You have to remember that, because imagine when you're working in his mouth, he just moves it like this. the drill, the fast drill is gonna go into his cheek and it's gonna come out through like this. Or it might hurt other soft tissues. That is very, very dangerous. So in order to prevent that, like we make sure the patient is stable, like he's not moving around. So that is the reason, like if you have seen any dental office, kid is like, wrapped up in a blanket, that's what it means. Like it looks, like terrifying, but it is for the absolutely safety of the patient and the doctor. Sometimes even that bird come and hit the fingers too. Like some of the kids bit me also. Like, so there are risks involved. Like, so you have two options. That is little less expensive, but if you have to put in kids sleep, it costs you 4 to 5 grand. Okay, whereas you would have prevented at home and gone to dentist every 6 months and do this called sealants done. If you had the sealants, this is a before and this is after. If you do this is cheap. This is a preventive, like your insurance covers 100%. If you get it done once they get the permanent tooth, the chances of getting cavities are like comes down at least 60 to 70%. The chances will be low. So think of it like those who have a first molars, it means who turn more than 6 years. If 6 and older, go and get your sealants done on all the back molar. Okay, that prevents cavities. Okay. Okay, the next one is gum diseases. We spoke about anyone has any questions about the cavities before we go to gum disease? Good, okay.
So Naveen, I have a question. So Naveen, since I have 3 kids, my question is, so if they go for the next dental appointment, whenever we open up and everything, we can ask them, especially my 7-year-olds, we can ask them to do the sealant there?
Yeah, I'm sure they would have done if you'd have gone like continuously every 6 months.
We have gone since they're 3 years old. So
yeah, so they would have done already.
Okay.
But they're not going to do again. I'm sure they would have. Some of them stay, some of them they don't stay. If they don't stay, you can ask them to do it again.
Okay.
But insurance won't cover that. That time they might charge you again. But I'm not sure about that. They just cover one.
I'll check them then. Okay.
Yeah.
Thank you. Thank you.
So this is the gum disease, like before and you see this one. Your gum has receded. Gum recession. That happens because you are ignoring you forgot to clean the teeth at that particular area. Plaque is gonna keep accumulating, build up, and plaque is nothing but bacteria. So it releases some kind of toxins, and they eat the bone away. So once they eat the bone away, the gum is gonna recede like this. You see that? So once you get the treatment, then see, it's gone. So this is where you need like a deep scaling. So don't assume that deep scaling is nothing, like they're not like trying to get money away from you. They'll look at the x-rays and see only if needed. Then they do deep cleaning. Or deep clean, basically they numb your mouth and go below the gum line. They go here like into the gum line because they need to raise this gum up and clean inside. Okay. So that is the gum disease. And gum recession, you see this one here is even worse here. See this one here. So this is all like this. All the white stuff is that's called plaque. That's when you don't brush, and what happens after 6 or 7 days? Let's say you missed one spot every day when you're brushing. You are missing one particular spot every day. And this soft plaque is going to turn into hard and it's turned into calculus. That calculus is a home for a lot of millions of bacteria. They release toxins every single day, and that eats bone every day, day by day. So basically, you have to remember, tooth in your mouth is withstanding because of the bone support. When you don't have bone support, the tooth is going to start like moving. It's like a pillar. So bone is like a pillar for your tooth. It's going to move and it's going to fall off eventually. So you have to go and get a cleaning also done, very important. And if they suggest you get a deep cleaning done, it means, yes, it's already you pass that regular cleaning stage, because you're not going every 6 months. It starts getting worse, and like, you started losing the bone. So you see here, this is a healthy gums. Okay, and if you see here, it's like more red. Anything inflammation red means it is inflamed because your body white blood cells or leukocytes are all they're fighting against the bacteria. It's like inflammation is causing because your body is trying to protect against all these bad guys. Okay. The next one is then it's gonna see here you have bone support here. Now it's gone here. The next stage is even like it's getting lower. The bone is coming down and down. So here like the 3/4 of the crown is outside. So rest of the 3/4 of roots inside. So you have a good bone support. But as you come to this picture, you have only like 1/4 of the roots supported by the bone. Rest of 3/4 of the tooth is like hanging there. So chances of staying is like, is very less over there. The next one is if you have any teenage kids, wisdom teeth. I'm sure you all would have heard about these wisdom teeth. My wisdom teeth bothering me, my third molars. They're also called third molars or wisdom teeth. So this is how they're gonna look like in the mouth. You see, this is partially erupted. This guy, why they don't come? Why they bother you? Because they don't have enough room to get into the oral cavity. So these, if you heard about the vestigial organs or rudimentary organs in our body, like an appendix, it used to be a functional once upon a time. But as people started eating like more refined food and like more cooked food, it became like a vestigial. The same way, people used to have a longer jaw, so it can accommodate the third molars. But as the evolution goes on, like our jaw structure is like gone like shrunken, and these guys don't have enough room to come into your mouth. So if you see here, see this one, it doesn't have room, so it's like a lying and is pushing this tooth. So because of this, you have two problems. One is it is damaging the healthy tooth. So that pushing is gonna give you a lot of pain. So you have to pull this one as well as this one. If you don't take care of this when it's younger, it's gonna damage the healthy tooth as well. So you need to, around like 16, I'll say ideal age, 16 years, you can take the wisdom teeth out. Maybe only 10% of the population, they come straight. I'm one among them. The 10%, I have all my wisdom teeth without any bothering me. Okay, the next one, that is the wisdom teeth. And if you want to see an x-ray, these are what they look like. You see this, all these guys? 2, 3, 4 wisdom teeth. See this this wisdom tooth angle. It's like a pointing towards this, and this one is pointing towards this, but they're not straight. They should be up like this. And like but they're trying to aim at other healthy tooth. So better get rid all 4 before they start bothering other teeth. The next one is crowding and malocclusion. It means like ortho. I'm sure a lot of you would have gone for braces, all that stuff. So these are different types of crowding. Again, crowding occurs if you don't have enough jaw space to accommodate all 30 teeth or 28 teeth. Because if you exclude the wisdom teeth, there are 28 more teeth. And if you have a smaller jaw and you don't have enough room for them like to grow, or some of them did not fall when they're supposed to, the baby teeth, they just like retained in your mouth. And the permanent teeth started coming and along with the baby teeth. So they both fight for the space. Since the permanent tooth doesn't have a room, see it came, see this tooth, it is out of alignment. This one is out of alignment. This is good. So these guys, they were outside the jaw because they don't have enough room. Like these baby teeth didn't let them in. But had you noticed that earlier, and if you are going to dentist like in a regular time, the dentist should tell you, hey, I think this guy is supposed to fall at the age of 9 or 10. By this time, it's already due. Do you want me to pull it so that I can create some space for the permanent teeth? He should. The dentist will let you know. So if you go, then they'll say, if you go and like get the it's called preventative extraction. If you do that, so the permanent teeth have enough room, you know, and they can come in position, and you can save on these braces again, which cost you 4 to 5 grand. Okay. The next one it's called deep bite. This is like it's not your problem. Deep bite is more of genetical. Their jaw structure. It has nothing to do with you. So these cases, you know, you can exclude. I mean, not from your negligence. And this is open bite because these teeth supposed to come all the way down and like close this, but they just stopped it. It's called open bite. There are like these different type of occlusions. Some people has, if you look in the jaw, all these. This is like, it's called class 3. Class 3 means if you, I know this is I'll give you a classic example. Like Ram Charan and Allu Arjun, the movie stars, they had this, it's called protruded lower jaw. It's called class 3. They get surgically corrected, like not just braces. So what the orthodontic surgery do, they push this lower jaw backwards and stable it here like with plates. So this is called class 3, or it will be corrected by, it needs not just a braces, it needs a surgery too. It's very expensive. It's going to cost you more money than the regular braces. If any of your kids has this problem, maybe only 10% of the cases get corrected. If it is a minor, then you can correct with the braces. But if it is a major problem, then you need braces as well as surgery, surgical correction. So remember that. This is braces, you know how the braces looks. And now we have Invisalign too. The Invisalign, those who are into more aesthetics, they don't want to see that metallic smile in their mouth. They can get these clear aligners or Invisalign braces. I think they come in sets every month. You have to wear them, and while eating and sleeping, you have to take something like that. So Invisalign. Yeah, some of the Invisalign cases, how they were before and how they were after. Okay. So this, I was talking about orthodontic surgery, right? So see, look at her jaw, how protruded. So what they do, they did a split here. They cut the jaw and pushed it back and did a staple there. So she was like this before, and look at her how she became. So that is called orthodontic surgery. The next problem is it's mostly in the elderly patients, called edentulism. Edentulism is nothing but lack of teeth. It can be partial edentulism or complete. Partial means like if you're missing 1 or 2 teeth, that is partial. If you're missing like more than, if you're missing like whole mouth, like now you see some of the old folks, it's called complete edentulism. You see here, these are called, you see this guy is missing this many teeth here. So this thing is called removable partial denture. This is removable. Like you keep it in the daytime and like take it in the nighttime and just wash it. And again, and the chances of staying, it's okay. But sometimes some rare cases, they might fall off while they're sleeping or while they sneeze. So, you know, there's some problem. But aesthetically, it's really good. It matches, blends with the teeth, other teeth. So people don't even know that they're wearing something. And the next option, this is a complete dentures, old people, and this is a dentures. They look good, but they're at the same time they're not stable. Like especially here, they might fall off if you don't wear those like denture adhesive cream. But not all the cases. But if they have a good jaw, I mean good ridge, it's called like a ridge. They can stay. And if you want like a better option in this, this is called implants here. So you can have some implants, get it done, and so that these dentures can stay here very, very well. But each implant costs again like more than 3 to 4 grand. So imagine three implants is 10 grand on top of the dentures. It can be if the people can afford those, especially most of the retired people with a good 401k income, they go for this because they want to have comfortable. Otherwise, there's no point. They can't chew anything. Yeah, see, did you see this one? This denture goes straight into these implants and they stay there, they stick there. So that's a good fit. They can chew and like, better than without implants. And the next one is bridges. You'd have heard like, what is this dental bridge? Why I'm missing only one tooth? Why is charging me for 3 teeth? So here is your answer. So let's say you miss this tooth here. If you want to replace only that particular teeth, you need to get implants done. But implant costs you around 3 to 4,000. The other option, and insurance don't cover the implants. The next option is bridge. Here, what the dentists do, bridge is nothing but like a connects. So since this tooth cannot stand all by itself, you are taking the support of these 2 teeth and making as a bridge. So that is called bridge. So they're going to charge you for all 3 units, no matter what. So that's going to cost around 2,000 or 2,100, and 80% will be covered by the insurance. Okay. It depends insurance to insurance. I can't give you exact like percentage. It's depend on the insurance. Okay. The next one is, this is the bridge case again. This guy is missing teeth here. So replace them. Okay. And here comes your implant. So basically what is the implant? Implant is nothing but you put this titanium screw inside the bone. Okay. You put the titanium screw that acts like your natural root, but except that it's a metal. It's not your natural tooth. So then on top of it, a screw goes in and like you fix the tooth, and that is a very permanent option. But for these implants, you need to maintain your gums healthy. If you are a diabetic or a smoker, these implants fail, and that's gonna be very expensive for you to get implant done in another less than. They're supposed to last for 20 years more, and if you smoke and diabetes and you're not taking proper care, they might fail in like a couple of years, and then again you have to go back and get a bone grafting done and get a new implant done. So you have to take care of your part too. This is how it's gonna look like. This is how, like, see this one inside the X-ray. That's how it's gonna look like. Okay. Any questions so far? Okay. The next one is the oral cancers or oral tumors. So you see this guy's swelling. It is called amyloblastoma, one of the oral biggest cancer, like oral cancer. You have to cut the whole jaw there. Like there is no option for that. This kind of it's called amyloblastoma, or in a general term you call oral tumors or oral cancer. Then they plated. They did a splinting with a chain. So this is how it looks like. Then the next one is, this is the most common with those are teenage kids. Dental trauma and sports injuries. So if most of the parents, they don't like to send their kids to these contact sports like football or basketball, because in teenage kids, this is the most common thing. Like they try to break the teeth. If they don't use the athletic mouth guard, there are so many chances that they might fracture the front tooth. And look at this one. This tooth completely came down, out of his alignment. You see this? It's supposed to be along with this line. It came down. It means something really hit hard at that tooth. So that that force, traumatic force, pulled the teeth. So what the dentist will do at this point, you have to go immediately. He's gonna push it back up and he's gonna splint it. Okay. So these are some of the sports injuries. So you have to be careful with if you have teenage kids. So this is my own case. This patient came with a missing tooth. She said her daughter did a headbutting. So you're gonna be surprised. See, look at this whole tooth. The whole tooth, along with the root, came out, and she was like, she's in her 20, 30. She go to office. Can you imagine like going to office with a missing tooth like that? She's like a so much like depressed and like a low esteem and like not smiling, like she's talking to me like this. So she showed me this and this kind of, and that it's been, if you can bring this within 1 hour, that success rate is like over 95%. And you have to keep this in either milk or under your tongue. It has to be saliva. Don't keep in water. If anything, for even kids' teeth or anyone's teeth, if you see a whole tooth came out, milk is the best solution. Keep in the milk. If you don't get milk, just keep under your tongue, but be careful. Don't try to swallow it. Okay. Then like she bought this tooth. What? This is the X-ray. You see this X-ray here? She's completely missing the tooth here. So what I did, I put the tooth back. Look at this. I put this, see, there is no teeth. I put this tooth back and I did a splinting there. See this? So this is the splinting I did. So I saw her maybe just, I think, just a month back. This is after 7 months. This tooth is still really doing good. So I have to do endo and like I remove that wire. She's very, very happy. And it's a corona crisis. I went for emergency and still she gave me a hug. I said like, I mean, like, what? I know it's crisis, but I can't, stop she couldn't control herself because she was so excited and like that. I mean, it's almost like she thought she lost the tooth, but like somehow like as a miracle, like this, these kind of cases that they don't last longer, but this case is especially, it's more than 7 months. Nothing happened and she's doing good. So what do you think? You still think a dentist is expensive? Anyone?
I think we make it expensive.
Huh?
I think we make it expensive.
What is expensive then is ignorance, like I said.
Ignorance, yes.
Any question?
Definitely. Before questions, Naveen, this was excellent. Very good presentation because a lot of good things we were learning. My little one didn't want to move out. So she was sticking around, she was looking into everything and she was asking questions and by the way, you were answering most of it. So she was actually happy to see all this. Hopefully she'll follow our guidance,
Yeah, I'm glad I did. Any other questions, anyone?
Thank you, Naveen. This is a good presentation. Now I know what to do if children or somebody breaks into their teeth, and then how to preserve them and then bring it to you to reconstruct it.
Thanks, Malli.
Yeah, nice. I mean, this is really a lot of information that I'm learning now, actually. And I was thinking that you're going to cover some of the what is that that other problem, right? Under the gum, you have a bacteria. What is that?
Gum recession, gingivitis.
Inside the gum, you have you will get some bacteria, right?
Yeah, plaque and calculus.
Yeah, because I had that problem. You know that, right? So
I know.
Yeah, but anyways, yeah, this is really good. Thank you. Thanks for your time.
You're welcome, today.
Hey, Naveen, this is Prasad. Thank you, Naveen. Question for you. Is there any other preventative things you recommend, especially not going to the dental doctor now because of the COVID-19 situation?
At this point, like if there is already active infection, there is not much you can do. But if there is no active infection and just a cavity, brush twice, floss, most of us ignore about the floss, including my son. I brushed myself, still he got one small cavity. I was really ashamed like that. He got a cavity and I have to do it myself. And like still though I'm flossing every day, still he got a cavity because kids, they eat like a lot of junk food, like at least every day. I'm sure like not many kids don't eat ice cream or candy in a day. Every day, it's everyday thing. So yeah, cut down the sugars and brush and floss if you can do, and make sure there is no active infection. Then yeah, you should be fine for another 2 months. It's not gonna happen rapidly. And rinse your mouth with the chlorhexidine if you can. If not chlorhexidine, maybe any Listerine or anything works.
So you mentioned about hydrogen peroxide. So can we use that too?
Yeah, you can use hydrogen peroxide. Yeah. Basically, hydrogen peroxide is a very good antimicrobial. It releases called a nascent oxygen that kills the bacteria. So you can, but just like 20, you don't need, actually, you can use chlorhexidine. That should work. Hydrogen peroxide, like not every day is not recommended.
Okay.
It's gonna stain your teeth, or like it's gonna burn the mucosa. It might be, so you don't want to do every day. We are doing only one time. Remember, we are doing only if that's a preventative to protect ourselves. Maybe if the patient is asymptomatic carrier, because this thing won't show symptoms for up to 14 days. So they might be asymptomatic, still they can be carriers. It's called asymptomatic carriers for 14 days. So it's our safety, and like still we are at risk. Yeah, some things you have to do, like a first line of duty.
So what do you think, like if we have any dental pain, first we need to contact the local dentistry.
Yeah.
If they
Ask
are
your
closed,
dentist if it's open for emergency, because governor said it's okay to open for emergencies. The emergency, what is emergency? It depends totally up to the doctor. Like if he thinks, even sometimes if your crown came off, that can be emergency, and extraction or pain. So anything. Your dentist should tell you, like, if
okay.
not, like my office is open like currently twice a week. They're taking patients only, very emergency. It has to be like really so much pain and they can't sleep, something like that.
So yours is Spencer Dentistry, right? It's
Yeah.
open.
Yeah, I'm not working because right now I'm just doing root canals only for now. I'm gonna start from May 1st. Some other doctors they're going and like taking care of other teeth. I mean, other patients who are in pain, just giving the prescription or something, whatever they can help. I mean, basically our goal is to stop you going to emergency wards.
Yeah.
That is more like a very dangerous thing.
Thank you, Naveen.
You're right. That's it.
Questions for Naveen? If not, Naveen, once again, thank you so much. And for others, tomorrow we have a nutritionist. Her name is Darlene Goodwin. She has her own radio channel and everything. She's a health coach. She's going to talk on what we can, buy in the grocery stores now to build up your immunity and everything. So if she can log in at 4 o'clock tomorrow, that'll be awesome. So once again, all these seminars that we are doing, it is free of cost. The whole goal is to educate people. See, there are like 3 other people who are behind me doing this, and all these presenters, they're doing for free. And if at all you know somebody who is into medical profession, coaching, health coach, please let me know. I'm more than happy to talk to them. It'll be either me, Vasu, Jaykantan, one of us will talk. And also I have a support guy, he's supporting from India, like my colleague from Ramchandra, his name is Karthik. He's the one who will upload all the photos, all the videos, and everything else on this. So once again, this motive for this is to educate people. So there is we are trying to avoid all kind of marketing on this, but I have to give credit to the presenters. That's why I always ask them to say where they are working or what they are practicing and everything, because they are spending the time for us. So thank you so much, Naveen. Really, really appreciate your time. So
Thank you, Ramki.
Thank you, guys.
Thank you, guys.
Excellent initiative, guys. Thank you so much.
Thank you, sir. Thank you.
Okay, guys,